very good. Because of that, the healing is very quick.
Yeah. It's still good.
Yeah.
Of course, you have too much swollen. When swollen go down, it will be better. The tip will drop by time. But I love your harmony between your nose and chin.
So good. Whoa, the chin.
It suits your face perfectly.
I love it, yes. Yeah. Rough night. Especially day 2, or at least the day after surgery. We're being discharged at 6 a.m. So if you want to paint around, this is the room that we stayed in. So there's a pull-out couch, my bed, bathroom. Majority of my pain, honestly, is the chin. The nose, like right where the stitches are, I'll feel stinging like time to time, but nothing crazy. The chin, however, is like robbing pain sometimes and like so much pressure. But yeah, I think me and Jesse went on like 4 different walks or outside of there from like 11 to like 3 or 4 a.m. Pretty long night. But yeah, that's all I had to say. Bye bye room. Bye bye room.
Hello. What is the opposite of yes? No.
Okay guys, so baby food, chicken noodle soup. I'm breaking apart the chicken and I put it into like a reasonable amount. Give it a little bit of soup. That's how I have to eat. So it takes me a long time. But this is the most I think I eat it out of anything, honestly.
I had some pasta.
Big jump, but day 3. It's 7 p.m. So sorry for not updating the whole day, but just to summarize, the nurse came in at around 7 a.m. I had a really hard time sleeping last night. Slept for maybe like 3 hours. But after she came in, we ate breakfast, which was really nice. Breakfast was good. And then once we came back, I was able to take like my pain medication and all the other medications you have to take. And I also cleaned my nose, which I'll show that here. I'll do my nighttime routine. You have to do 3 different sprays twice a day. And then there's this one spray that you do 3 times a day. 11 or 12, probably like 12ish, the doctor came in. So the nurse and doctor come in once each day after your surgery to check in on you, which is awesome. They always ask me to take this off and look at my stitches. They take a picture of it and send it to doctor, or they just look at it and they're like, okay. What did we do? Really this afternoon, it's been a lot of resting. I took a good like 3-hour nap around like 2 to 5ish. Maybe like 1 to 4. And then I was able to like clean my skin, brush my teeth. Baby toothbrush. I'm gonna do a video after this whole little series of everything that I actually used and helped me throughout this journey. But let me tell you, I cannot fit a full-size toothbrush in my mouth or a full-size spoon. Baby toothbrush, baby spoon, awesome. And yeah, we just ordered some room service. Okay, that's crazy. Oh, is this the Indian rice? Oh, it's like a whole meal.
Yeah. And you got chicken too. Oh, they kind of burned my food.
What the heck? Have another quesadilla? No, don't they do that? Like
So.
even their pizza and stuff? Okay.
Well,
I got chicken broth soup. I already had it. Really good. I'm so sad they don't have the noodles. It was supposed to come with, how did you pronounce it?
vermicelli.
Vermicelli. Then I got buttered rice. And I guess this Indian, I don't know, Indian curry chicken. Quesadilla with chicken and fries. And look, you even have a little bit of,
You want some guac?
maybe I can try it. But we're gonna eat. And then we're planning on Jesse needs to, not kidding. Jesse wants to go to the gym and swim. And then I'm gonna walk on the treadmill after I eat, take my meds. And then I'll show you guys my nighttime routine with my nose and just my skincare in general. Also earlier, the only way I've been able to shower is with Jesse's help. There's a detachable shower head. Literally just bar soap, rub it all over my body. I have this body scrubber that I use, and then some body wash, and then I feel cleaner than ever.
Show us how clean your belly is.
What? Okay, and now that I've rinsed my teeth, I'm gonna go in with this mouthwash that they give you. I don't know if it's gonna focus, but do like half of it. It's like really hard to squish around in your mouth. That's how you see me kind of rocking side to side. But I also can't keep it in my mouth for as long as I'd like to, just because I like can't breathe out of my nose, so I have to spit it out so I can breathe. And if you're getting this surgery, you will realize, like, I don't know, maybe, I don't know if this is universal, but every time I clean my mouth, there's more of that yellow stuff. I don't know what it is, but it doesn't go away. But it's okay, but I'm just gonna clean over my mouth, and then I think I'm gonna do the gauze next, and then my skincare. My lips are all clean, and I kid you not, Aquaphor has been carrying me. Like, you have to bring one of these with you, for real. Like, there's no ifs, whats, or buts about it. I'm just gonna lather these up. My bottom lip is still really numb. Like, I haven't had feeling in it since the surgeries. But my top lip is completely fine. Now, first, before I clean this, I want to make sure I already have my next one made, just in case my nose gets real runny. But I'm on the 3rd day, and honestly, my nose hasn't felt like it's been running too much. So it shouldn't be an issue, but I'm still going to do it just in case. And since it's my PM routine, I'm going to go through all 3 of the different sprays as well. They give us like these. You see this here? And then some gauze. And this is like the tape, which actually is pretty gentle. If you have sensitive skin, this tape hasn't given my skin any irritation. But the first tape from the first one of these did. So I don't know what that was about or what type of tape that is. Whatever. And basically, all I'm gonna do is fold this bad boy in half, just like that. And put it right here on the middle and just keep it to the side while I clean this. So this may be a little graphic, but I want to keep it real with you guys. And so while I clean it, I'm going to grab another little piece just so I can hold underneath. This is kind of a lot, but it feels so good once it's done. So now I'm going to take this off. And now what I'm going to do is just swipe this a little bit. And so I'm going to do this 2 ties on each side. And now I do this one. Once on each side. Then I'm going to finish it off with 2 of these sprays. After these last 2, you want to tilt your head upwards and inhale, but it's so hard, I'm not going to lie. And now you're going to go in with a Q-tip, which I like to wet first, and put this ointment on it. And this is what's going to go directly on your stitches. So I put a good chunk on here. And I'm just going to use this mirror here to help me. Oh, I'm leaking. It's okay. And then I'm just going to put it right on them. And now I'm just going to put this on. Just like that. I definitely could have made this one a little smaller. You see how it's overlapping my lip? But honestly, I don't care. I'm going to go to sleep, so I'll fix it in the morning. So I just been wetting cloth pads and using that, just wiping that all over my face to kind of rinse. And then I use a cotton pad and I put essence water. So I like kind of rinse my face with the water pad, and then I use a toner pad with this to add like my essence water, and then I do my moisturizer. Keeps me pretty refreshed. Okay, so now I just wipe my face, head in my toner, and I'm gonna go in with my favorite moisturizer ever, the Orhan Cetaphilite. This is the best moisturizer you can like literally ever get. The time is 10:06 next day, like 10:06 p.m. This morning we woke up. I actually have been getting better sleep now, and it's awesome. I'm so glad. I'm getting like 3+ hours of sleep each time I sleep, which is like, oh. But we just had breakfast, and then we came up here, refreshed, and then, like, very refreshed, I mean, changed my gauze, wiped my face, do my skincare. The same thing that I showed you of my PM routine is my AM routine. And then I was just kind of stuck here in the hotel. Not necessarily stuck, but I didn't feel ready to go out and explore yet. So Jesse took like a little day trip and he was exploring while I was here. And I started to edit this video, or at least part 1, and then also just relax. And then the cleaning people came in. The cleaning services, honestly, this hotel is so amazing. One thing about ClinicHub that I'm so grateful for is just that everything comes together as a package. I couldn't imagine having to plan more than just the rhinoplasty. Like, whether that be having the restaurant in the hotel, having like a gym, or having room service. Like, all of these things mean so much when you're in a position like me. For lunch, I really just ate like a banana, drank some water, and Jesse brought back sushi. That was so good. So I had that around like 4 p.m. So I had breakfast around 7, lunch around 4, and now I'm eating leftovers for dinner. So we have this curry chicken from the other day with a little bit of buttered rice. And then my chicken broth, which has been carrying me. I'm not gonna lie. And then for dessert, I'm just gonna have this banana. Jesse also has been going down to the shop that's like literally right underneath us. I haven't been yet, but I will go one day. He got me peach juice, and I already had the berry juice that he got me, but these are so good. I literally feel like a child again, I'm not gonna lie. And then he also got water. And that'll be my dinner. And then I'm gonna take all of my meds.
But I can't wrap that. I feel like she already knows I got it for her. I'm gonna put all of these on top.
It's just gonna be like.
Alright, medication haul. So I've been taking these since the day after my surgery, because while I was at the hospital during my overnight stay, they just pumped me with drugs through the IV here. So Jesse, take it away. What are you giving me?
Okay, so this is Alex's medication routine. We started with this, and we always start with this.
These are the worst. They're huge.
Every
They're
morning.
like this fucking big, and they taste disgusting. It's like they want to dissolve as soon as it touches any saliva. These ones, the worst. But the rest, honestly, are fine. But those, man, once you see that, you know it's going to be a little gross.
I honestly don't even know how to pronounce that.
Don't even try. Whatever. It's an antibiotic, though.
It's an antibiotic. You take it twice every 12 hours. So we take one in the morning after her meal, one in the night after her meal.
Yeah.
We also continue in the morning
As soon as I wake up.
the stomach protector.
Probably like a laxative almost.
I don't know. But it's not too much. All of these medications you take until they end.
Yeah.
So, I lied. We actually start with this one every morning because it's before we eat. Then we continue with this one after her first meal. So every morning. Then we go with the pain medication. This is a Dixofen. 25 milligrams. It's her painkiller. So it's right here.
Yeah, and all of them, it has a little like night, morning, day. So like,
in case you forget.
Cause she tells you, but honestly, I was not gonna remember.
You're
that
like in
shit.
so much
I was
pain.
not gonna
We were
remember
like
that.
off of an hour of sleep. I recorded it just in case, but you really won't remember it. So
Yeah,
it's
nice
here.
that they do that.
Yeah, again. This one's not 12 hours though, so
It's
we just take it after
whatever.
every meal.
I usually when I'm in pain, I'm like, all right, let me eat something so I could just take this. But honestly, pain has been pretty minimal. Now that we're like a little bit past this first like few days.
That's good. And then we ended off with the fourth and final medication. Oh, there we go. And these are just her allergy pills. She takes this every night before going to sleep, and that's really it.
Yeah, so I still need to take that for tonight, and then I'm done. But that's what you could expect. And again, everything is included. I didn't pay extra for any of this. This is just what the nurse gave me whenever we came back to the hotel after the surgery, after the hospital stay. And she gave me that rundown. And they still have continued to come in. When Jesse was on his journey today, the doctor came in, saw me. All they do is ask for you to take this off for them to see your stitches. Ask if you're having any trouble pooping or anything. Or if you need anything, to let them know. And then that's it.
I've kind of noticed that the nurse always comes in around 7 a.m.
She comes in hella early.
So she kind of wakes us up even if we don't.
Even if we're not awake.
Even if we're not awake, we're first.
She comes in early, and then the doctor comes in at like 11 to like 11:40.
Yeah, around
so probably like
time.
honestly like 11:15 to 11:30 is like a pretty good time frame for them.
They say that they come in between
11 and 4, but they've never been here past noon.
It probably depends on your floor. They probably
Yeah.
go up or down or something,
Yeah.
so it might just depend on your room.
Yeah. But the plan for tomorrow is to edit, continue healing, eat some good breakfast, maybe go out and explore. We're gonna see. But I also want to find out the specific date when I get the cast removal, because that's like the holy grail of this all, you know? So I'm excited to do that. So, this is lunch. We have McDonald's chicken nuggets. I'm not going to eat all these fries or for Jesse as well. But yesterday, Jesse surprised me with sushi. It was so good. And if you chop it up with like your spoon, it's honestly not that hard to eat. At least for me now. So I'm also gonna have some sushi.
Chat, she did her hair. Also, today's
I know I
Saturday.
actually got the most put together that I have been this whole time.
Yeah, today's Saturday. Last Saturday we were in Madrid. That was last week.
It's crazy. But look, these are like no preservatives. I never had a no preservative nugget for McDonald's. I was gonna say Chick-fil-A.
Show the little packaging.
Look, it's
We
fried.
have friends. And show the ketchup. Show the little lid.
Get it, cap.
And the fries. I tried to fry. They were pretty good. And they're like almost white.
Oh,
This
cheers.
isn't an exaggeration. Nope.
And then for dinner, we're thinking kebabs. I think I might go outside later today for the first time. I feel like I'm like a COVID patient or something, honestly. But I've just been editing part 1 of this vlog, and honestly, I just finished it. So I'm feeling really good. And then we did finish editing our Madrid vlog because we were in Madrid for 24 hours before coming here. And yeah, honestly, pain today has been like nothing, which has been amazing. Earlier, my nose was a bit dry on the inside, my doctor noticed, so the nurse came in and she literally scooped the inside of my nose, and there was a decent amount of blood, because no one had been told me yet to start cleaning the inside of my nose, which I had seen other people start to do already, but no one told me personally, so I was like, I mean, whatever, right? And then she told me it's very important that I clean the inside of the nose, and I was like, well, that's good to know, right? But anyways, now I've been cleaning it. I've also been adding more ointment on the inside and Aquaphor on like just the parts of my nose that I can touch that don't have tape. So, yeah.
Guys, Alex suggested kebabs, so we got kebabs.
Yeah, also, big accomplishment. Hair is washed, period. It actually wasn't that hard. If you just tilt your head up enough and you kind of cup and spray it. But that's not what we're wanting to talk about right now. Look at this! Jesse went on a mission. I don't even know what do we get started with.
Actually, wait. Before we continue, I'll show you. It said it was within 2 minutes. You can barely see it. But I literally just walked down there and it was right there. So it's just around the corner, literally.
So the first thing that's calling to me is this. Oh, look at that, guys. Wow.
But that looks best. It looks so good.
That looks so good. Okay.
I didn't even see anything though.
There's meat. There's vegetables.
That looks good. Okay.
It looks really good. It's warm too.
That's good. Yeah, it's really
What
warm.
is in this?
I don't know. Let's open it. I'm putting it on.
Oh
Ooh.
my god. This is that rice.
I think that's the pita I ordered.
And it comes with warm meat and a jalapeno tomato.
Yeah. Okay, and then what's in here?
Oh.
And then this is your... Oh, no, this is my cheese pita.
What? You got a cheese pita?
Yeah, I didn't think it was going to be that big.
Jesse, this thing is
I thought
massive.
this was the kebab. Okay, that's the kebab.
I mean, this is perfect though, because we could eat it like this. Yeah, we're gonna get into this right now. Good morning, guys. And I just got 8 hours, so like 7-8 hours of sleep. Wow. I can't wait to get this off. But I should be getting it off tomorrow. Because today's the 4th and we leave the 6th. And you get your cast taken off the day before your flight. And the nurse just came in. She's what woke me up. She just puts the little thing on my finger. And then the thing here to check my blood pressure. And then she takes a picture of my nose. Calls it a day. But we're gonna head down. Well, we're gonna refresh up and then go downstairs and eat some breakfast. And Jesse's gonna go on an adventure today. I was noticing I'm having a lot of puffiness just in this area. I'm so grateful I didn't have to deal with the bruising and like extreme swelling, but I think it's all falling now, whatever swelling I did have. I was looking back on pictures from yesterday and I didn't notice it, but it started already puffing up. But this morning when I woke up, I was like, OMG, what the heck? So we just ate breakfast, and whenever I came back, I iced my face for like 20 minutes, and like my cheeks, not my eyes. I think that honestly helped a little bit, but I just took my medications, and now I'm gonna go for a walk on the treadmill. Jesse's on his little adventure. He's taking the ferry to one of the islands. So I'm excited for him, but I'm just gonna stay here. I still don't feel comfortable really with going out. I really just don't want to risk anything. But I think maybe later I'll go out or maybe tomorrow. But yeah, so come with me to go on a walk.
I'm actually gonna head down to Katakoi. I think that's how you say it. It's like it's on the Asian side. I think it's like a more historical site. This is Alex's first time going out.
We got a croissant and we got a strawberry like ice cream with sorbet. Pretty much sorbet. That's the whole one. Okay, good. This is good. Okay, guys. Officially last day in freaking Istanbul. Our flight leaves tomorrow morning at like 7 a.m. But since it's our last day here, the day before the flight, I get this bad boy removed. Literally, since I got it on, I was like, damn, I can't wait to get this shit off. But we just got all ready. They text us through WhatsApp and kind of update us or our transportation and whatnot. And so they've been updating us throughout the day. At first, we were supposed to get picked up at 2:45. And then 2:15, and now 1:15, which is in about an hour, which is perfect, because we and Jesse want to go out and explore afterwards. But we're going to show you the cast removal. All I've done today is eat breakfast, and then we walked on the treadmill for a bit, and then we started packing up a little bit and doing our last little laundry. I just did my skincare, a little bit of, pick-me-up makeup, and then it's going to be time. So this is me front-facing. To the left, to the right. And then we'll do it again whenever it's off. And I'm also gonna let you guys know, like whenever they take this off, I guess I'm gonna have a bunch of yellow stuff on my skin. I wonder if they like thoroughly cleaned that, or I might need to do my skincare whenever we get back.
There are 2 stitches inside your nose.
Okay.
First of all, I will remove them. Okay, up your head. It will be very easy. First of them. And second one. It's okay. Did it hurt?
This pressure.
You have some stitches around your columella. The stitches will dissolve by themselves in 2 weeks. I'm not removing all of them, just I'm cleaning. They will dissolve by themselves in 2 weeks.
Okay.
Now I will clean inside your nose.
Okay.
Don't worry, please, don't worry. Okay, and the other side. Okay. Could you wait?
Yeah. Oh my god, yeah, I can. Yeah.
It's better than before.
Wow.
Now I'm removing the tapes. Your chin looks perfect,
Oh my
honestly.
god.
Okay, up your hands. Okay, I'm cleaning
Oh.
your.
That's so weird.
It's a little bit weird feeling, it's normal. Okay. Now I'm removing the casts.
Okay.
That's the easy parts. Procedure. Actually, your skin is very good. Because of that, the healing is very quick.
Yeah.
I love the result from now.
Amazing.
It's amazing. Of course, you have too much swollen, and the swollen go down. It will be much better than now.
Oh my
I
god.
have to press a little bit to do massage. You want to see?
Wow.
Yeah, yes.
Okay, you can look at the mirror. The left side is better.
Oh my gosh.
Don't be so amazing.
Wow, it
I'm gonna
looks
cry.
really good.
Oh my god. Wow, it looks so it's still good.
Yeah.
Of course, you have too much swollen. When the swollen go down, it will be better. The tip will drop by
Yeah.
time. But I love your harmony between your nose and chin.
So good. Whoa, the chin.
It suits your face perfectly.
I love it, yes. Yeah, whenever it drops, it's amazing.
Yeah, it's dropped. And you couldn't move your lip area. It is normal. First
Okay.
2 months. After 2 months, your
It's
lip
wild.
muscles will come back.
Wow, this is so crazy. Wow.
I love it.
Wait, I want to take a picture real
Yeah.
quick.
Now, our surgery is 50% of final result. The rest is your body reaction. We
Okay.
try to control the body reaction with some recommendations. First recommendation is taping. These tapes should stay 1 more week.
Okay.
Don't remove these tapes. Of course, you can take a shower. These are waterproof. Don't worry about it. After 1 week, when in the shower, hold the water first directly to your nose, and you
Okay.
can peel easily.
Okay.
And then you should do taping on net nights for 3 months.
Okay.
1 week they should stay, then you can remove it and start to use on net nights for 3 months.
Okay, that sounds good.
When you do at home, one of them to bottom of your nose, like that. Second of them to lower part of your nose, like that. And third one, like that. And upper part of your nose, you should press a little bit harder, and you should cover all part of your nose with fourth one and fifth one. You should press
Okay.
harder, don't be gentle.
Okay.
At tip of the nose, you should be gentle.
Okay.
I'm using a lot of tapes, you will use just 5 tapes.
Okay.
And it is a little bit early period to remove the cast, because of that I will do new one. 1 week later, you can remove all of them.
Oh, it just feels so weird.
Yeah. So, and the other recommendation is retainer.
Okay.
Retainer is a silicone apparat to keep your nostril shape even as much as possible. This is like a triangle shape. Narrower part should be top, wider part should be bottom.
Okay.
And you should replace like that. Up your eye. First week, you should keep it during the day and nights.
Okay.
Okay, don't remove it. Of course, when you feel uncomfortable, you can remove it, use your spray, rest 1 hour, no problem. But mostly, you should keep it.
Okay.
1 week later, only at nights for 3 months. In summary, 1 week they should stay, all of them will stay.
Okay.
And 1 week later, you can remove all of them and start to use taping on night nights for 3 months,
Awesome.
retainer on night nights for 3 months.
Okay, awesome.
If you have any question, don't hesitate to contact us anytime from Instagram, or our post-op team can help you. Also, please send us a picture in first month, 6th month, and first year for follow-ups.
Okay, awesome. Okay, thank
I am
you.
so happy.
Yeah, you're so
Nice to meet you.
Appreciate it. That's so crazy. The nose is kind of scary.
It's a lot.
It's a lot.
I'm gonna have to get used to
I think it's gonna look like fake. Oops. But I'm in love with this. Like, this looks amazing. Like, it's not even what I like really cared about, but I ended up like loving it even more than my nose a little bit. Oh, my nose is like really like Doctor Who right now. Hey, sign me up for the next Whoville video. I'm not kidding. It's still beautiful, but it's like a lot. It is. But I think once it does drop, hopefully it all lines up. It also did look like almost like this is like a little. I don't know if you've seen it. I need to look at the pictures again.
I got our video. I did see it. It bruised or what?
Like, it didn't look exactly like shake. It looked like a little, which is fine.
It's probably just.
It's crazy. Well, I cannot wait to wash my
It's
face.
sector 69.
Okay. Directly on. To the left. To the right. We should have done that whenever I got it.
Guys, I didn't film an outro, but the date is now January 19th when I'm editing this, which is kind of a while, but kind of not. Anyways, this is what it's currently looking like. I really like it. I've gone back to work and everything, so I've been seeing people's reactions, and they seem to like it too. I really think it's starting to match my face more, and I mean, obviously it is still a little piggy. Well, it is gonna drop a lot more, but we still need this bad boy to go down. But I love it, and I honestly rate my experience a 10 out of 10. Jesse's here. I don't know, do you have anything to say?
I'm sleepy. I'm tired.
Okay, he's sleepy, he's tired. But ClinicHub, 10 out of 10. If you're thinking about getting a rhinoplasty or a chin implant, anything of the sort, I hope my journey has helped you in some way, shape, or form. And please feel free to smash that subscribe and like button and leave a follow to support my channel.